Hi there, Dr. Tom Grodski here. We're talking today about integrative naturopathic family medicine. And what exactly is it? Well, it's a integration of conventional medicine and naturopathic medicine. Conventional medicine we're all familiar with. It involves physical exams, lab tests, the underlying science of disease and pathology, and pharmaceutical drugs in order to treat those conditions. And naturopathic medicine is essentially an amalgamation of all the traditional approaches to medicine as well as alternative approaches to medicine. So included in that are such modalities as clinical nutrition, herbal and botanical medicine, Chinese medicine, acupuncture, chiropractic, homeopathic medicine, counseling, mind-body medicine, and the list goes on. It's quite extensive. And so integrative naturopathic family medicine is an integration of these two approaches, and what that comes down to, or what that means for a patient, is that when they come to see a doctor, for instance, let's say someone comes in with the common cold, we're able to identify that through conventional medicine that this is in fact a cold. And from that perspective, bed rest, fluids would be a good start. And then pharmaceutically, we have either things for fever or aches and pains. There isn't, however, any medication for the cold itself. And so that would be the extent of the conventional approach for such a thing as the common cold. From the naturopathic perspective, we approach patients from a holistic manner, or holistic perspective, which means we look at the person not just as a collection of organs or organ systems, but as a unified person in which all their different organ systems work together as a unit in a functional way. And in addition to that, there is a mind, there are emotions and thoughts, there is spirit, there is also an environment that the person lives in. And so we look at all these different factors. There's different names to this. Sometimes it's called a holistic approach, a functional approach. There's longer terms like psycho-neuroendocrinology, so even the psychosocial biological approach, many different names for it, but it essentially means that you're looking at a person from a very holistic perspective. And so from that perspective, we ask ourselves, is this happening very frequently, such as with a cold? If so, then what is the underlying cause? Is the person getting enough rest? Are they getting sufficient good food, nutrients? Is there a lot of stress in their life? What sort of environment do they live in? Are there any other triggers, factors, risk factors that could be contributing to their condition? If so, that is the focus of treatment. We try to address the approach for the individual. And so in total, the integrative naturopathic family medicine approach is a very individualized, holistic approach to medicine. It's sensible, it's practical, and we have an incredible ability to choose appropriate treatments out of this vast gamut of options. Everything that I mentioned, including the conventional approach of pharmaceuticals. And so it's really the best of both worlds. Thank you so much.